Duchenne muscular dystrophy: innovative diagnostic techniques. Duchenne muscular dystrophy, also known as DMD, is a rare genetic disorder that affects 1 in every 3,500 males. This disease is caused by a genetic mutation in the dystrophin gene. The dystrophin protein is an important anchor that helps to stabilize the muscle tissue, and it protects it from damage during contractions. The lack of a functional dystrophin protein results in excessive muscle degeneration and the buildup of scar tissue. This disease is an X-linked recessive disorder that is often passed down by the mother, who is a carrier of a mutated dystrophin gene. Boys typically start showing symptoms around 2 to 3 years old. At this point, young boys typically start showing problems with walking, speech delays, and other learning disabilities. By the age of 10, most boys are wheelchair-bound and have significant skeletal deformities. Loss of life typically occurs due to cardiac or respiratory failure in the mid to late 20s. Current diagnostic techniques include biopsies, blood work typically to check for CK levels, and genetic tests to look for mutations in the dystrophin gene. Currently, there is a long delay in the diagnostic process. Onset of symptoms is typically between 2 to 3 years old and averages around 2.7 years old, but they are typically not presented to a physician until about 3.6 years old. Additionally, the first diagnostic test is typically not sent until the child is about 4.2 years old, and the average age of diagnosis is about 4.3. Overall, there is an average delay of 1.6 years from the recognition of symptoms until the time of diagnosis. There are many potential consequences to this delayed diagnosis. First, it can cause delayed treatment. Some studies have shown that over the past 15 years, there has been little progress in lowering the average age of diagnosis. However, as treatments advance, this delay in diagnosis has become more and more critical to the patient's prognosis. Additionally, it can create emotional turmoil for the family at a very critical time in this child's life. Delayed diagnosis for such a severe and rapid disease can force families into fast decision-making in regards to the child's treatment. Access to clinical trials can also be hindered due to this late diagnosis. Currently, there is no cure to DMD. However, it is thought that future treatments such as stem cell therapy or gene therapy would be most beneficial if it was administered prior to the child showing symptoms. Currently, there are a few prenatal diagnostic tests that are being studied and could potentially diagnose DMD prior to a baby being born. Currently, there are 2 types of invasive prenatal tests, CVS and amniocentesis. CVS stands for chorionic villi sampling. This procedure uses a suction tube to remove fetal cells from the chorion, or these are also known as pre-placental cells. One benefit of this method is that it can be done at about 11 weeks into pregnancy. However, because this procedure is invasive, it carries about a 1% risk of miscarriage. Amniocentesis is another type of invasive procedure in which a needle is inserted into the placenta to draw amniotic fluid. This amniotic fluid contains fetal cells that can then be genetically tested for mutations in the dystrophin gene. This method Can be performed as early as 16 weeks into pregnancy and carries a slightly smaller risk at 0.5% risk of miscarriage. Non-invasive prenatal testing for DMD is still being studied. One of these methods uses cell-free fetal DNA, or CFF DNA. This DNA is only requires a blood draw to be extracted from the mother, and it can be done as early as 9 weeks into pregnancy. This method works by extracting the fetal DNA from the mother's bloodstream. Essentially, as the baby grows, fetal DNA can be leaked out of the placenta and travel through the woman's blood. CFF DNA is already being used to diagnose chromosomal disorders, such as trisomy 21, 18, and 13, as well as Turner syndrome, and they are shown to have a very high success rate in diagnosis. One complication of using this method for diagnosing DMD is that DMD is a X-linked single gene disease. Because of this, it can be difficult to differentiate between the fetal and the maternal X-linked genes. Additionally, fetal DNA only makes up about 10% of the total cell-free DNA in the mother's blood. Thus, a fast and accurate technique is needed to amplify the DNA to identify SNPs. A new technique known as massively parallel sequencing has been shown to allow for single gene diseases to be identified by the CFF DNA. MS works by cutting the DNA and then adding linkers, and then putting this DNA onto flow cells for PCR amplification. The nucleotide sequence can be determined by labeled nucleotides. Fragments can then be aligned with computer analysis to get a full genetic sequence. This method allows for fast sequencing and identification of SNPs, which are single nucleotide polymorphisms in the fetal DNA. These can then be compared to the mother's in order to determine if the child received a normal or a mutated dystrophin gene. Some benefits of prenatal testing are that it allows the families to access early counseling. Additionally, it can give adequate time to emotionally prepare for the to determine emotionally prepare to have a child with DMD, as well as to determine a proper course of treatment. It also allows parents time to research and join clinical studies, and it can provide the child with early treatment, which can help to slow the progression of DMD and take that burden away. These are the references. And thank you so much for listening.